Now, yesterday we told you the story of a young man facing enormous hospital bills after major surgery because he's new to the country and uninsured. Tonight, the response from officials and how it still leaves him in limbo. For nearly 2 months last year, Josue Rivero was at Humber River Hospital receiving critical care before and after having his legs amputated.
Entonces, cuando yo despertó del coma, pues obviamente.
When I woke up from the coma, that health program had already finished, so the pressure began. Like they started asking, do I have insurance? Do I have OHIP? How was I going to pay?
¿Cuál iba a ser mi manera de pagar?
The young Mexican had moved to Canada a year earlier to be with his mom and was uninsured. So the bills for his stay at the hospital started piling up to nearly $90,000.
These are people who are amongst the most precarious in our society. They're often racialized, they don't have immigration status, they work very precarious jobs. They often live in more significant poverty than the rest of the general population. They can't afford these high medical bills.
The Ontario government's Physician and Hospital Services for Uninsured Persons program, which would have covered the expenses, ended while Josue was in hospital. Those advocating for universal health care in Ontario launched a petition at the time to restore it, while letters expressing concern were sent to the minister from several prominent medical organizations.
What can you do at this point to offer that health care to those people?
So let's clarify some things. If you need emergency surgery in the province of Ontario, you will get it and you will not be charged in an Ontario hospital. We have community health centres that are funded very specifically for individuals who are undocumented refugees.
The Ontario Hospital Association says that cases differ, and whether uninsured patients qualify for coverage depends on the situation and context. But, quote, the OHA is working closely with its members and health system partners to address the health service gaps that remain for uninsured patients. Josue, meanwhile, isn't getting the help. Instead, he's simply hoping for the best.
Pues ha sido un proceso muy largo.
Well, it has been a very long process. It has been a bit complicated. This experience definitely changed my life. It made a 360-degree turn in my life. But I still have many expectations for my life.
Pero pues sigo teniendo muchas expectativas en mi vida.
Now, the community health centers the minister referred to do exist to help people with basic care, but don't necessarily include specialist emergency care or hospital stays. One of the gaps yet to be addressed in the system.